am most glad to inform you that today you will not only leave here inspired, you will leave here equipped to become a catalyst of change.
There is the science behind caregiving, and we are here today to have this discussion. We're going to talk about care culture. We want to talk about our perspective towards care. We want to talk about the economies of care. We want to talk about technology, how it's influencing care.
The idea is we keep talking about culture, but we don't know that culture is deliberate. And for you to change the next generation, you have to start from a very young age to inculcate them with those practices so that it's easier for them to accept new technology, especially that will better the healthcare sector. Thank you.
When you are almost 80, definitely home care is very important. Even when you are still strong, agile, very busy and active, you need your own person.
So when people come on board, they have the experience, they bring in some expertise and they have some fund too. Bank can meet them with their own funding too, because bank knows that everybody needs health care. I know Lagos State is trying, but other states must follow suit.
You can never create a health system for the poor. You can only create a standard health system and then facilitate access for the poor. Because in healthcare, there is no 50%. The other 50% is somebody's father, somebody's mother. So if healthcare must be provided, it must be all class across board. Policy is the only tool that government has to shape healthcare, which is the link between that policy and public-private partnerships.
There are many agencies that want to work with serious people, and I use that very intentionally. Serious, so not the ones that just want to start and put it in working in collaboration with something government, because there are some very funny human beings and organizations. There are people who are definitely interested in building a new generation of leaders. I want every single one of you here to leave this room as more like an ambassador for disability care and concern.
The common mental health problems, so depression, anxiety, epilepsy, to mention but a few. Again, when people are equipped with the right information, either at the community level or at the level of the professionals in the community. So I believe that when we continue programs like this and strengthen it, starting at the level of the community, but strengthening it going upwards, we're likely to empower more and more people and change the landscape of what mental health looks like.
I always tell my patients, anyone with any chronic condition, especially hypertension, diabetes, I tell them it's a long-term relationship between four entities. Managing those conditions is a long-term relationship between four entities: the patient, the doctor, or whoever is taking care of them, their machines,